Today's episode of the Stallside podcast was brought to you by Rood and Riddle Veterinary Pharmacy.
Hey Bart, how are you doing today?
I'm good today. How are you?
Great, thanks. We've got one of our sport horse practitioners on the show today.
We do. Dr. Daniel Devis is here with us today. He's been with our practice for a few years, originally from Colombia. Has a little bit of a thoroughbred practice and a lot of sport horse, and it's going to be interesting to see what he has to say. He's a great guy.
Yeah, super good guy, actually, yeah. And he really likes the rehab and the sports medicine thing. And it's just going to be interesting to hear his approach to when somebody asks him about a horse, my horse is not performing, how he looks at that horse and his approach to what needs to be treated, what needs to be sort of like managed from sort of a more holistic sort of approach.
Lots of ideas about alternative and new therapies.
Yep.
He's very open-minded, so he's a good one to bounce ideas off of.
Yeah, absolutely. On Stallside this week, we talked to Dr. Daniel Devis about his sport horse practice. Dr. Devis, welcome to Stallside.
Thank you. Thank you for having me.
Thanks for being with us today. Good to have you.
Thank you.
Daniel, tell us a little bit about yourself.
Well, I am from Colombia, South America. I was born and raised in a farm near Bogota, where I'm from. I grew up with horses, dogs, cattle, and obviously I grew up riding. My dad was the one who encouraged me to pursue veterinary medicine. I went to vet school back in Colombia. I graduated in 2012, and immediately I got chances to do internships and fellowships here in the States. And one thing needed to lead to another one, and, became an associate, and eventually I joined Rood and Riddle 5 years ago. My fellowship was focused on lameness and sport medicine and diagnostic imaging. And right now, pretty much I focus mostly on sport medicine and rehab with a little bit of general farm work.
Okay. So what does a day look like for you?
Well, it really depends on the time of the year, really. Normally during the summer is when I have the most amount of work. And that's basically because most of the show horses come to Kentucky. And that sounds a little bit complicated when you see it like that, but the way I always explain is that show horse people like to run away from the cold. So during the summer, fall, they're going to be here in Kentucky, or they're going to be in New York or in Michigan. And during the winter, they like to snowbird in Florida, or sometimes they go to California. And so for me, during the winter, like this time of the year is a bit slow because they're not here. So for me, right now, I could have a day with one lameness and nothing else, to a day that I'm having x-rays and rehabbing a horse and vaccines and something like that. So right now, for example, today my day went from doing a vaccine on a horse and rechecking a laceration to doing 3 Coggins and fixing a laceration. So it's not that much sport medicine at the time. But then when I go down to Florida, it's full time. This horse is having issues with changing leads, or this horse is, refusing the jumps, or this horse is not willing to do his Piaf, whatever it is, depending on the discipline.
Yeah, and you mentioned going to Florida, and people know about the Wellingtons and Ocalas. Are there other areas in Florida that you see growth?
Yeah, so most people know about those two places. Ocala has the World Equestrian Center and HITS. And Wellington has WEF, which is the most two places that people like to go. But there's other places. So, like for example, very near to Sarasota, Florida, there's this town called Miaka City, where they have this place called Terranova Equestrian Center. Actually, I've been doing a lot of work for the last 2 or 3 years there. They just started their own show, FEI rated, but they also do their own shows. They do from eventing, dressage, hunter jumpers, and I believe, but don't quote me, driving, and they all run through the year. So right now for me during the winter, it's a great opportunity to just go down there, and some of my clients go down there, and actually I get more clients, and I go there. I did 1 week in January, 2 weeks in February, and I'm about to go 2 weeks next week. And they have, like I said, 2-start FEI jumpers, and they have like big names going there. not just to name drop, but they have like riders that go to the Olympics and they have gone to the equestrian games and all the high level. So like Ken Farrington, Daniel Blumen, there's good people going to this shows, and it's getting bigger and bigger. And I really think it's a place that I want to encourage to go because it's completely different. And it's beautiful there. I gotta show you guys some photos there.
Yeah, well, that's great that there's growth in the industry because, as you say, people think about two places, but they don't realize there are actually other places in Florida that are growing. Yeah. I mean, the climate's there. I mean, the population density is there. The interest is there. So it's great to see that there are other areas in Florida that you can go. You mentioned your focus on sports medicine. That is a very complicated area. Yeah. I don't think people really fully understand exactly how broad the scope is on sports medicine. Everybody has things in their practice they like doing and they do more of. What would be your area in sports medicine that you like to focus on? And could you tell us something interesting that you do that people wouldn't probably realize falls into the scope?
So one of the things that I get called a lot is not mainly for, oh, my horse is sick or my horse is lame, but my horse is not performing well. Meaning it's not jumping, it's not collecting, it's not changing leads, it's not performing. So one of the things is for me to try to figure out how much of this is actually pain related to behavioral issues, to trainer or tack or rider. So a really interesting case I had a couple of years ago was I was looking at this pony, large pony, who the trainer and the rider both used to say, this horse is lame, we cannot get him to go. And then I would look at him in hand, trot him, flex him, nothing. This horse is fine. Put them in the lunge line, nothing. And I was like, okay, well, let me see what you guys are talking about. Like, show me. And so they got on this horse, and fair enough, as soon as they start going, oh yeah, this horse is showing some hind limb lameness. And I'm like, why I'm not seeing this? But I still flex the horse, and it makes no difference. So I finally decided to take the rider off, and I said, do me a favor, lunge him with the saddle on. Mm-hmm. Still a little bit uncomfortable. And I say, okay, take the saddle off, and if you're brave enough, get on this horse and ride him. That was it. The horse started going a lot more comfortable. Mm-hmm. What happened was that this horse was really wide for the type of saddle he had, so he had some back soreness. So I thought that was really interesting that just by doing something crazy, which a lot of the show jumpers would not like to do that, like go bareback on a horse. I mean, it's not really, sane to do, but it worked. We figured it out. We had the horse had his back checked by a chiropractor, and we did a saddle fitting. Mm-hmm. So he needed to get a different type of saddle. And I remember, I think we shock fitted his back, and he's back and performing and doing great.
Yeah.
So those kind of cases are really interesting for me.
Yeah, it is interesting to make sure that you're looking at the horse doing what they are doing. And the other thing that you did that's important is listen to the people who are with the horse.
Yeah, in this industry, there's a lot of, you got to listen to the trainer, because even though they're not veterinarians, they're not in the medical, they know what they're talking about, and they know their horses. So it's different for, a groom to tell you, this horse is lame, to a trainer to tell you this horse is not performing well. And both could be right, but you got to look at it in a point on both perspectives, if that makes sense.
Sure. Mm-hmm.
So you're right. You got to listen to them.
And the quick and easy thing is just say, oh, okay, let's inject this hox.
Yeah, and that's usually what they all think. Oh, I think my horse just needs his hox done. And we probably suggested that, but I'm like, normally I do not like to treat unless the horse really needs it.
Mm-hmm. Well, where would you be? You would inject the hox and you're still in the same place.
Plus, you can have that. So I always like, look, we can do this, but it's like throwing a dart in the dark.
Yeah.
You don't know what you're going to get.
Yeah. And, I haven't done sort of much of what you do, but it'd be the same thing as everybody would always want like a medical fix or inject something, and you have a look at it. And saddle fit, or actually the quality of the saddle, is actually a lot, because I've had situations where I just bought a new saddle, the horse's head shaking, and they think the horse is head shaking. No, it's shaking its head. Those are two completely different things. So then there was one client that she'd bought this new saddle, and the horse was throwing its head around. I says, just humour me and put the old saddle on and ride it. the problem was gone. And so she brings the saddle and she's saying what a great discount she got on the saddle. It was a very expensive saddle, but I got it for a really great price. Flipped it over and the saddle tree was broken. So there was this shard of wood pushing into the horse's withers.
Yep.
Well, she wasn't very happy about the messenger, and so I never got asked back to that farm. But she got the saddle fixed and the horse was fine, right? So don't like the message. So I did myself out of a client, but we did the right thing. And so that out-of-the-box thinking that you talked about is what you need to do, because you inject or you give pain meds, the horse is still doing the same things.
Yeah, you're just masking the
You're
problem.
masking it, or it's just reputationally damaging because you didn't solve the problem because you didn't look at the horse. And so, to that point, you've got to listen to everybody because everybody has their input. And I would absolutely agree with what you're saying about the trainer in that they look at the horse, they know what they're looking at. Yeah. You absolutely need to listen to the people associated with the horse. So what else do you do sports medicine-wise? I mean, that's a great story, but you're going to be asked sometimes to do something therapeutic where you see a need, okay? Yeah. And as you mentioned, you're not just going to inject things for the sake of it, but there are things that you can bring to the table that not everybody can.
Yeah, so I really like rehab part of it. And when we talk about rehab, it's not just injecting, waiting, and rechecking every 30 days. There's a lot more that you can do in the meantime. You can do from therapies, from shockwave, laser, and nowadays there's a lot of magna wave and all that stuff to actual physical therapy. We have these places where you can take horses where they can swim, have them aquatrade or cold water spa, or they can be taken into a hyperbaric chamber, or just simply have a chiropractor acupuncturist going through them every once in a while. That part of let's say my life I like. So when I get like a call, I have a horse with a swollen leg and it's lame. I mean, it's kind of mean to me to sound, but it's really interesting to me to try to figure out what it was or what it is. And when I figure out what it is, for example, a tendon, and I know okay, well, we have, for example, a ruptured flexor tendon. We can do this and this and this and that. And I like to mix it all together from injecting orthobiologics, which just to give you, I guess, the audience a little bit of what that is byproducts from the same horse that we use and separate to put back into the horse, such as PRP, prostride, stem cells, IRAP, et cetera, to combine it with some some therapy machines used in therapies, laser, again, shockwave, and actually seeing the progress of how they develop. The only downside of that is that people tend to be a little bit impatient about it, and they think that one injection usually heals it, and you can just keep going. And for the most part, horses tend to heal a little bit slow, especially for tendons and ligament injuries.
Yeah, when you think about the stresses that are put on a tendon, I mean, you look at the cross-sectional area of the tendon, and there's this horse landing on this, and that is like taking the entire mass of the horse and decelerating it, right? So then you take its next stride. So you've mentioned tendons. Say you were looking to integrate your therapy, treating a tendon or ligament. How would you approach, as you mentioned, like a torn ligament or suspensory, or maybe a strain? How would you actually approach that? So
I guess the best way to explain you will be for a case I had last year actually. This woman have moved into Kentucky recently, and it was an eventer. I believe she was doing training level, and one day she noticed that the horse was a little bit lame and he had a thick leg. She actually called the emergency line here at the clinic, and they looked at it and they said, look, this looks tendon related. We can treat it in the meantime, but you're going to have someone else to look at it and ultrasound it and go over it. That's when I got the call. Went over the clinic, over the farm, and it was 3 out of 5 lame. I think it was the right front, and he had a thick tendon sheath. And then I immediately knew there was something going on in there, so I immediately put my ultrasound, and yes, there was a small core lesion over the superficial digital flexor tendon. So that's when we gave her the option of what to do. You can always wait and let nature run its course, and eventually they will heal, or you can treat it in a way. So this horse was sent to Kesmark, the rehab facility here in Versailles, And I treated that horse with a byproduct of amnios, that comes from amniotic fluid, rich in growth factors and stem cells, followed by laser therapy every other day for a total, I think we did 12 sessions. And he ended up healing beautiful. He went back to his normal level of work. And as far as I know, he's still doing great.
Yeah, and I think you bring out a really good point, because with a lot of the, I call them complementary therapies, right, is that people think, you can just use one.
Yeah, alternatives, yeah.
Yeah. But you're actually bringing in, it says, you got to do conventional stuff, but also out of all of those complementary things, you probably need to do more than one. Like, you just can't put a laser on a leg, you just can't do the orthobiologics. You need to actually look at an integrated approach. And the other thing is give the horse time. Yeah. Because, as you say, people are impatient and want to get back and ride that horse, but they injure it again. And away you go, you got to start all over again. So if you approach, say, that leg, what would be the time course for that leg to come right over the treatment period that you gave it, and the rehabilitation time that you would like to see it have afterwards, and what things would be done during that period before that horse competed again?
So in this case, fortunately, the owner was not that big in a hurry, so she did let me do the whole process the way I like to. So day one, let's say we have our diagnosis. So the day after that, let's say we will inject them, and we will wait 2 weeks, and we will start doing this alternative of complementary therapies from the laser shockwave, for example. We started lasering him Monday, Wednesday, Fridays for a total of 12 sessions. Then in between, every 2 weeks, we're doing shockwave over the area. Mm-hmm. And then we will recheck on ultrasound every 30 days to see how it was progressing. I think by 30 days, we had that lesion hypoechoic, which, just means that it's healing, but it wasn't fully covered and it was still a little bit swollen. We give him another 30 days of just, if I believe, it was swimming, I think, in cold water spa. And then by 60 days, we were lucky that this one had completely healed. The good thing about this one, it was a center type of lesion, like axial. So it was not that complicated. So I believe between 60 and 90 days, it was back on their tack. And by the time she went back to showing, which I kind of lost track because she moved out of the state again, I think he maybe took her 4 months. But that all depends on owner.
Yeah. And that's a really important point, is that the horse is going to dictate to some degree, but people need to give the horse the chance. And again, this was a very complicated process that the horse went through, with multiple modalities were actually used on this horse to get it back to athletic function. Because I think a lot of people just think, as I say, you're just sticking, inject something, do some acupuncture, do some heat, do some ultrasound. All of a sudden, no, there's a whole suite of things that has to be done. And how do you develop that approach? How do you sort of get to the point where you say, okay, this is what would be reasonable to do in this situation?
Well, in my case, I guess it's based on experience, but it all depends on, one, budget, and two, the type of injury. So a lot of people say, why don't you just put steroids in this kind of lesions? And a lot of people know that, in this type of lesions, tendons or ligaments, it's actually contraindicated to do, because actually it will delay process. It's better not to actually not put anything. So, instead of going through that route, you can go the orthobiologic route that will help promoting and speeding up the process of healing, which that's basically what laser, for example, does, or shockwave. We're just trying to speed up the process. We're not doing anything magical. And if you allow me to actually go through that route, laser, which I do a lot, and people ask me why this is work better than not doing anything. It's like, look, laser is literally just going to imitate what the body does, but it's just going to do it a little bit faster and maybe a little bit more coordinated.
And that was my question, because I was doing the math as you were talking about this, because it was a complicated suite of treatments, but that's not for everybody because of budget. So do you feel like you just got the horse back to work quicker by doing that, or did you facilitate healing? Was that horse healed better at the end of this than he would have been with just more time? I know that's a complicated question.
No, it's not actually. I would say both. Like we got him back faster, and I think the actual lesion healed better because we used this type of medications. One thing I tell everybody is like you can use the laser and you cannot use the laser, and you might have the similar result. One thing is that, especially when you're talking about fiber pattern inside of an ultrasound, laser helps to make that fiber pattern better in a way of makes it even. Think about it like a scar, you know? When you get a scar, it will just heal wherever the way it wants. When you use the laser and you use it the same direction as the fiber pattern, as the fiber alignment, you're actually helping it grow that same way. So you compare the ultrasound of a horse without it and with laser treatment, and you can see a difference that they actually have a even fiber pattern. So that's, in that way, I say both. You know, this horse got better because we all did this, obviously, and faster because we did all this. So does that make sense?
Yep.
Yeah. You're creating an environment where the horse heals itself faster.
Yeah.
Right? Yeah. But the horse still heals itself. And getting back to the budget thing, if somebody has a horse they want to ride it, so every month it's standing in the stall, not going anywhere.
Sure.
Yeah.
That's money they are not getting value and sort of like keeping their relationship going with the horse. And so you got to weigh up the fact is if it takes a couple of months longer, that's 2 months board.
Sure. Yep. 100%.
And you can put that towards treatment, and then you can enjoy your horse more.
Yeah, exactly. Because if you add that from feeding, boarding, training lessons, all that adds up. So it's like, well, you can let it be, or you can.
The opportunity costs are very high as well.
Yeah. So you have quite an interest in like sports medicine rehabilitation. Is there any other aspect of your practice that you'd like to tell people about?
I mean,
it sounds like you have a very varied practice and you basically do everything.
A little bit. I mean, I always tell people like, look, if you want me to look at the legs, perfect. You want me to look repro, I'm not your guy. Mm-hmm. You got to call a veterinarian for that. Sorry.
He does have a really cool dog that hangs out with him all day.
Oh, really?
Yeah. I have Louis, a coonhound that goes with me everywhere. They love him at the farms. They actually say hi to him before they say hi to me. So
Daniel and I sit in the radiology room a lot together every afternoon, and Louis loves to put his wet nose right on my elbow.
Yep.
It's his favorite thing.
He's a bully towards Dr. Barber.
Yeah, well, somebody's got to keep him down and under control. Yeah, well, that's good. It's good to have a little dog to drive it because everybody's worked their angle, right?
Yeah,
you probably want to see the dog instead of you.
Keep us sane too.
Yeah, that's seriously right. And so that was Stallside for this week. We've been talking to Dr. Daniel Devis about his practice. He's into sports medicine and rehabilitation. See you next time.